Now we are gearing up for Black Girl Body Love Part 2. So, welcome back, ladies. I hope you had an amazing morning and are as excited as I am about today's summit. Like yesterday, we have, with great intention, created a loving environment for you where you can feel safe, loved, and hopefully open to share your questions, things you can feel uncertain about, and some of the anxieties that come with navigating your ever changing, beautiful Black girl body. In an effort to expand on the conversation we started last year, the goal of today's first session is to talk candidly about the Black girl adolescence, the Black girl's body, and the impact of misinformation across Black generations when it comes to our physical health, our vaginas, our developing breasts, and our periods. Help me welcome the doctors. Moderating this super important conversation is UYS family member Dr. Rebekah Fenton. Dr. Rebekah earned her undergraduate degree in human biology from Stanford University before attending medical school at the University of Pennsylvania in Philadelphia. She now works as an adolescent medicine fellow at Lurie Children's Hospital of Chicago, where she has put considerable focus on the experience of Black youth within the medical field. Dr. Rebekah Fenton also serves as the Chief Physical Health Expert for the Uniquely Used Summit for Girls, and we are excited about the panel of MDs she has put together. First up, Dr. Maya. Dr. Maya Cloyd is a pediatric psychiatry resident joining us from Indianapolis, Illinois. She is currently a member of the Triple Board program at Indiana University and aims to both destigmatize and be an advocate for mental health in minority communities. Outside of being a practicing physician, Dr. Maya Cloyd also enjoys anything related to beauty, travel, and wellness. She believes travel is a form of her wellness, and we are excited to have her join us today. Next, we have Dr. Brandi. As an assistant professor of dermatology and pediatrics at Northwestern University Feinberg School of Medicine and a pediatric dermatologist at the Anne and Robert H. Lurie Children's Hospital in Chicago, Dr. Kenner Bell is certainly experienced in the realm of Black girls and their unique needs when it comes to skincare. A graduate of Baylor College of Medicine in Houston, Texas, Dr. Kenner Bell knew she wanted to be a pediatrician since elementary school. Believing every single kid deserves to be happy and healthy, able to put their best foot forward, feeling confident and loved, we can't wait to hear from Dr. Brandi for the second iteration of Black Girl Body Love. And last but not least, Dr. Natasha. Oops, sorry. Okay, let me start again. Last but not least, Dr. Natasha. Dr. Natasha Ramsey is a board certified. Sorry. Okay, sorry. And last but not least, we have Dr. Natasha. Dr. Natasha Ramsey is a board-certified pediatrician in training to become an adolescent medicine specialist. Dr. Ramsey credits her adolescent health teacher with inspiring her to want to learn more and teach others about sexual health. Combining her passion for art, desire to empower, and educate the youth about their sexual health, while being committed to diversity, equity, and inclusion, Dr. Ramsey birthed Gorgeous Doc LLC during the COVID-19 pandemic, complete with resources and content that celebrate Black and Brown youth. So, we cannot be more excited to hear from you four Black women doctors. So, without further ado, take it away and let's dive right in, Dr. Rebekah.
Thanks so much, Alyssa, for the introduction. And we're so excited to be here. And I'm really excited to be back from next year and also bring some of my friends. Right now, we've got Dr. Natasha and Dr. Maya, and then Dr. Brandy's going to be joining us shortly. But I got to hear some of the last questions that you all were talking about periods. Periods is something that we talk about as physicians all the time. And I wanted to be able to just kind of talk a little bit more about that before we jump into the questions that we have. So I will start off with you, Dr. Natasha. I'm wondering, there's lots of different options that people can use to manage their periods. Can you mention what some of them are and how to make sure that patients can use them safely?
Sure. Hi, everyone. I'm Dr. Tasha. So there are many different period products, and it really depends on what works best for you. So starting with period panties, those are one of the newer things that have been advertised to people for their periods, and they're very absorbent. And I know you guys just talked about that in the last session, and they're reusable. You can wash them and wear them for several hours. There's also reusable pads, which are little cloth materials that you can insert onto the inside of your underwear. There's also pads. There's pads that come in different absorbencies. So there's some that are for a light day and some for a heavy day. There's also tampons, which are small, like little cotton tubes that you can insert into your vagina and they catch the blood. There's also menstrual cups. So menstrual cups are little cups that you insert also into your vagina and it catches the blood before it leaves your vagina. And then there's also menstrual discs, which are like small, kind of like the menstrual cup, but a little bit smaller, and they're not reusable. They just last for like a couple of hours. So there really are a bunch of different options. And in the past, the FDA, which is like the organization that mandates what kind of materials and products that companies can release, did not really keep track of what materials were going into period products. And so there's been a boom in all these new products that are coming out that make sure that they're using cotton that is organic, making sure that things are healthy and don't have any long-term side effects or issues for young women, or for menstruators, I should say. The one thing I did want to clarify, I know you guys had talked about toxic shock syndrome in the
Yeah,
last.
what is that? Explain that for
Yeah.
people and how do we make sure that they avoid that risk?
Yeah, so toxic shock syndrome is it is a syndrome that occurs when your body is exposed to a specific toxin that is produced by bacteria. So there's a specific bacteria that when there's enough of it that builds up, releases this toxin that can cause your body to have fever, break out into a rash. It can be very deadly. Toxic shock syndrome is very rare. It does not occur often, and most often occurs when people use something called high absorbency products or tampons, because the bacteria is able to stay and hold on into that product and then create this toxin, which then creates toxic shock syndrome. So it is very rare. There are very few people that actually get toxic shock syndrome. It is something that is a risk when you use tampons or menstrual cups, but it is very, very rare. So I do want to encourage you, if you are someone who is interested in using tampons or menstrual cups, to not be discouraged. It is a very rare side effect of using those products. It only happens if you use very high absorbency products or if you use them for a very long, long period of time. So if you, for instance, tampons and menstrual cups, you should change every 8 hours at the most. If you use it longer than that, then it increases your risk of toxic shock. And even people who have mistakenly forgot to take their tampon out for a couple of days still have not had, don't, it's very rare to have that side effect. So just wanted to clarify that for you all.
Awesome. I appreciate that. It's so helpful to make sure that people know that there's lots of different options, especially with different activities people involved in, and also everybody having their different preferences of how they want to care for themselves. I so appreciate that you all got your wellness kit, which had some pads in there, and also know that, like, depending on if you're active, tampons or underwear may be other options that you want to be able to incorporate too, and to feel comfortable trying all of those out while still making sure that you're protecting your body and being safe. With that, I think our whole panel is here, so we'll get going. My first question to you all is, tell us a little bit more about what you do as far as what does it mean to be adolescent medicine, triple board, or dermatology. So I will have Dr. Brandi start.
Hi, my name is Brandi Kenner Bell, and I am a pediatric dermatologist. I started off in pediatrics residency and decided that I wanted to do dermatology as a specialty, but I didn't want to give up pediatrics. And so I applied for dermatology while I was doing pediatric residency and was accepted. And so I finished my pediatric residency, took my pediatric boards, was a board certified pediatrician, and then went straight into dermatology residency. So after I finished dermatology residency, I wanted to make sure that I was as specialized and educated as possible. So I applied for a pediatric dermatology fellowship. And so after I passed my derm boards and became a board certified dermatologist, I did a fellowship, which was 1 year, and then did boards for pediatric dermatology. And so I'm a triple boarded pediatrician, dermatologist, and pediatric dermatologist. I practice mainly dermatology on children, but as you guys all probably know, when you go to one doctor, if you have questions, you ask lots of other questions. And so I still practice a lot of pediatrics in my dermatology clinic just because I see my patients so often. I see them actually probably more often than their pediatricians in a lot of cases. And so I love that kind of intense relationship building that I get to have with my patients because I see them so often. I treat a lot of eczema, a lot of acne, a lot of warts. Those are kind of my bread and butter cases, along with my zebras, really weird skin diseases that only I would know what it is. And that's why I specialize. I love being a specialist. I love knowing a lot about one thing. Pediatrics drove me crazy because I didn't know enough about anything, I felt like. And so I love being a specialist in that way.
Thanks so much, Dr. Brandi. Dr. Maya, can you tell us a little bit about what you're specializing in and where you see patients?
Yes, so I'm Dr. Maya Cloyd. I am in Indianapolis, Indiana. I am actually a resident, so I just graduated medical school and I'm doing my training. So the pediatrics, adult psychiatry, and child psychiatry residency, there's only 9 in the program. It's 5 years long, so I'm going to be doing all 3 of those specialties back to back to back. And I mainly right now for the first year seeing pediatrics. I'm kind of everywhere. I just finished my hematology oncology. Basically, I'm working with kids with cancer and maybe like sickle cell disease a lot right now. And next, I'm going to go to adolescent medicine. So I'm doing a lot of back and forth for the first 5 years of my training. And when I'm done, I'm going to do outpatient child psychiatry, maybe 1 or 2 half-day clinics of general pediatric medicine. So that's my dream.
Amazing. And since you mentioned adolescent medicine, it's a perfect segue to Dr. Tasha. What is it that we do for the high school students who are watching?
Yes, so I am a board certified pediatrician, which means I take care of children ages 0 to 25. Adolescent medicine is specifically taking care of young people who are ages 11 to 25. And so anything that a teenager may need, ranging from mental health, understanding their body, puberty, menstrual problems, period issues, STDs, pregnancy prevention, all of that stuff, sports, injuries, nutrition. So anything that a teenager may need during that time, or a young person may need during that time, and that transition from becoming a child to becoming an adult is what we take care of. Oh, also, we also do gender medicine. So we do a lot of different things. We're like a mixture of like a bunch of different specialties all in one. But it's really, really awesome because we get to do things like this and talk to young people like you.
Well, great. Thank you all so much for those introductions. We are going to keep it real with you today, starting with the fact that I was trying to be cute, put a little eyeliner on, knowing full well that every time I do that, my eyes start tearing. So literally, as soon as I introduced us, I started getting the tear come down, and that's why I had to run out. I've got my tissue. So we've got high school students who want to keep it real with them. And let's start with the realness of our own field, which is the reality that less than 3% of Black women are physicians. And hopefully there's some future healthcare providers in the audience. So I'm wondering, how did we decide to become doctors, and what advice would you give to Black girls interested in healthcare fields? Anybody could jump in and start.
I can start. So I didn't want to be a doctor for a long time. I actually fought it. I wanted to be a writer. I was like, oh, I want to be a journalist. I want to write about anything. I just didn't want to do medicine. My mom was worked in the health field, and I was like, oh, it's just so gross. Why would you want to work in a hospital? But then when I was a teenager, actually, you guys' age, I wrote for a teen sexual health magazine called Sex, Etc. And that just opened my eyes into how much there was a lack of information for young people about their bodies, and how much how there wasn't enough honest information. And depending on where you live, depending on what you look like, depending on your income, that you were going to get not the right information that you needed for your, to make the right decisions. And then also that would impact your health in your future. So that really got me revved up, and I was like, this is not right. We need to fix this. And then in college, I majored in a field called public health, which I'm happy to talk more about if you guys are interested. And while I was doing public health, I took some of the classes I needed to go into medical school. And then I realized, you know what, in order for me to do what I really want to do and make the impact I really want to make, I really do need to pursue medicine. And so I decided that I was going to do both medicine and public health. And so I did my medical school training, and I also did a master's in public health at the same time. And then, like I said, I had joined the teen magazine when I was a teen. And so my loyalty had always been to teens and sexual health. And so I ended up going into adolescent medicine. So it was a journey. It wasn't like I was like, I know I want to be a doctor ever since I was a kid. It was very roundabout, and I just followed my heart. I followed what I was passionate about. I followed what it was that I wanted to do and change in the world. And that led me to where I'm at.
I think that that's a great contrast to me. I always knew I wanted to be a doctor. When I was in elementary school, and we used to do fundraisers for St. Jude Children's Hospital, and people would ask me what I do. I want to be a baby doctor. I want to be a pediatrician. And so I always wanted to do pediatrics. But I think both me and Dr. Natasha's story speak to the fact that your path isn't always straight. And it's okay to change your mind. And it's okay to maybe make a wrong turn occasionally and have to make a correction, or to make a right turn and still decide that, even though that was right for me then, that's not right for me now. And I want to do something different. And it's okay to make mistakes, and it's okay to have to start over. And it's, your life, you have so much life ahead of you that you want to make sure you end up where you want to be, doing what you want to do. Getting up and going to work every day is hard. And so you want to have to get up every day and do something that you love, and something that hopefully impacts people around you and makes the world a better place. You guys all know right now we are struggling as a world, as a society. And I think that all of us probably feel like we're doing our parts to make things better each and every day, no matter how small it seems. So as the person who always wanted to be a doctor, but who took a, kind of roundabout and cricket path to where I want to be, I know I'm exactly where I'm supposed to be now. And I love it.
I also knew since I was little that I always want to be a doctor. My mom was a nurse, and my dad is from Tuskegee, Alabama. I never got to meet my grandmother because she passed away from health related things. And I feel like if she would have had a good doctor, she wouldn't have passed away. I know that. So I wanted to be that change. And I also got my master's in public health. I actually did a post-bac program because, I'm not going to lie, I'm not a good test taker. And I just needed a little bit of help. So I did a post-bac program called MedPrep. That's in Southern Illinois. And I did that as well as getting my master's in public health at night. So it's not always a straight path like the beautiful doctors are saying. So yes, just want to encourage that. Keep following your dreams.
Wonderful. Okay. And then I'm wondering if you could all speak to how does your field really help the health of Black girls? So Dr. Tasha, adolescent medicine, Dr. Maya, I appreciate if you focus on like psychiatry, and then Dr. Brandi, dermatology. Like, how are these important for Black girls' health?
Yeah, so as an adolescent medicine doctor, I do two different things. One, I do general, just like medical care. So the same way you go and see your pediatrician and they do your vaccines and they check your height and your weight and all those things, ask you all those awkward questions. That's part of what I do. The other part of what I do is very specific care. So like I was saying, if you have a menstrual problem, or if you have a sports injury or something that's very specific to teens, if you are interested in starting birth control, things like that, then I also do that. And so I find that it is super important that young people are able to find doctors that they can talk to, doctors that they trust, doctors that look like them, and doctors that hear them and understand their concerns and don't dismiss them, and then also teach them. I do a lot of teaching in clinic, but also like outside of clinic, on social media. Like any chance I get, I'm teaching, because I feel like knowledge is power. And so it's critical to have doctors at this transition point when you're trying to figure out who you are, trying to figure out if what's happening to your body is normal, trying to figure out if that relationship you're in is a relationship that you should be in. I've definitely have had conversations with my patients about, you need to leave him, he's trash. Like, and it's like not medical, but at the end of the day, like that is the encouragement sometimes that that young people need. So as an adolescent medicine doctor, even if I'm not the person that's going to manage it, I may be the person to identify, okay, you have a mental health issue, I'm going to send you to Dr. Maya. Or you have a terrible acne problem and we've been trying everything and it's not working, I'm going to send you to Dr. Brandi. And so I see adolescent medicine almost as a gateway to being able to help connect young people to the other things that they need, and also helping to like foster like who they are and who they want to become.
All right, who wants to go next?
I guess I'll go next. There's such a stigma, especially in the Black community, about mental health. And there's studies over and over and over again that you get better care with people that look like you, and they take your, I'm not saying you can go to anywhere you want, but it's just more relatable, to be completely honest, when it's people who look like you. So I think that's why it's so important to have representations in all these areas in life, and just to know how to advocate for yourself, how to advocate for others. And it's really, really important, especially in mental health. I think now it's becoming more popular and it's being more talked about, which is wonderful. But I think it's also important to educate our parents' generations that it's okay to pray about it and go seek therapy, you know? So yeah, I just want to destigmatize mental health, and it's okay to talk about these things.
I think from a dermatology perspective, our skin is the first thing people see. Period, end of sentence. And we all know what stigma is carried in this country and across the world by people with darker skin. And so I take care of the part of you that you can't hide, the part of you that you must present every day to people. And when we are always, struggling with how we present ourselves and how people are perceiving us, I think that it does not help to feel insecure about the skin that you're in. And so I work really hard to make sure that my patients of all types, but especially my young ladies and gentlemen of color, feel good about the skin that they're in, because there is no way in the world that you can go out here and present yourself and feel good about yourself if you're self-conscious about what you look like. And some specific things that I think that need to be addressed by a lot of dermatologists. Say, for instance, if we're talking about acne, which Dr. Natasha brought up, so much of what we're worried about is pigmentation problems. And so you go to a doctor, a dermatologist, and they fix your acne, but you have all what we call this post-inflammatory hyperpigmentation. And in so many cases, that's what my patients are worried about, my patients of color. They could care less about the acne bumps. They are really, really bothered by the post-inflammatory changes. So on that very first visit, I know to say, okay, tell me what's really bothering you, because I can fix your acne, but let's talk about what's really bothering you. And oftentimes they'll come back and their acne is beautiful and they're still unhappy. They're still unhappy because they have all these post-inflammatory changes, and they know that that still makes them look different and they still feel different, and they don't feel like their acne is under control because of all the post-inflammatory changes. And so again, I just work with my patients to hopefully instill self-esteem and self-confidence by being able to present their best self every day to a part of their body that they can't hide.
I appreciate that. I'm so excited. Y'all, that was only the intro. I do, before we move topics, want to say, Dr. Brandi, just for our adolescents, can you kind of explain what are those post-inflammatory changes you're talking about? I know we as a doctor group are like nodding along, but like just wondering so that they can kind of hear that description and be like, oh yeah, that's something I'm experiencing too. And what does that look like?
So, melanin is beautiful, period, but melanin is also complicated. Melanin does things that, that protect us, but it also does things, it is very sensitive, that can leave some lasting changes. So whenever you have a pimple, a lot of times, especially in darker skin, it will leave a dark mark after the pimple is long gone. Sometimes if you have a cut or an injury to your skin, it'll leave a light streak or a dark streak long after the skin has healed. And those color changes can last for years sometimes. And so we call those changes post-inflammatory, meaning after there was inflammation, hyperpigmentation, increased pigmentation, or hypopigmentation, decreased pigmentation. And we as a people struggle with it a lot more simply because of the beautiful melanin that protects us, like I say, and makes us beautiful. But it is so sensitive, and yeah, we have to work with it.
All right. So let's talk about stress. I feel like everybody kind of like thinks they understand what stress is. Yesterday was really focused on kind of like the mental aspect of stress, but I also want to bring up like how does stress affect our bodies, and especially for Dr. Maya, how does even the stress we're experiencing in our mind can be experienced in our body? So anybody feel free to jump in.
I guess I can start. There's a lot of different changes, physiologic or like changes in your body that can happen with stress. Stress is not always a bad thing. So back in the day when, you know, in the primal days, we needed that response to survive, what we call fight or flight, right? So when that happens, there's increased hormones that happen to basically, which it's like a stress hormone, which causes different reactions in your body. That can be increased heart rate, it can be sweating. And nowadays it's kind of evolved to where it can happen in places where you're not really even like, well, it's a perceived stress. Like, you know, some people, like what we say, like Summer Walker, right? She keeps talking about her social anxiety and her like going out to different crowds and stuff makes her stressed, right? It's stress to me, it's somebody's perceived response or what they think is might be a threat and the way it affects the body.
I think also when I think of stress, I think of a hormone in your body called cortisol. So cortisol is like a hormone that is released during times of stress, and it's very helpful and like, you know, giving your body the energy that it needs to like act quickly when there's a time of stress. But if you are having something called toxic stress or stress that is constant, then those levels of cortisol are constantly high. And then you're having these changes that are happening in your body that are supposed to be temporary, but then become prolonged. And so this is part of the reason why being stressed in a short period of time is okay, but being stressed over long periods of time and consistently being stressed is not okay. Because your body is not meant to have those high levels of cortisol at all times.
And I would say that stress affects your skin always, always. And I tell people all the time, you cannot have healthy skin if you don't have a healthy body. And the toxicness of stress on your body will absolutely display itself in your skin, whether it be flares of your eczema, flares of your acne, flares of your alopecia, which so many of us struggle with. So it absolutely affects every aspect of your health. And I see it in the skin every day.
Yeah, no, I appreciate that. I feel like the last year I've been seeing stress pop up in different places in patients' bodies. I mean, even for myself, I had this heartbeat that just would not stop, even when I was chilling watching TV. And at first I was like, is there something wrong with my heart? And after doing all the screening, I'm like, no, I think that's actually just anxiety there. And I've seen other patients have that same thing. I've also seen people describe pains in different parts of their body. And often sometimes we have this idea of like, oh, you're telling me it's all in my head, but that actually the mind and body are so connected. And sometimes our body has no way of getting rid of that stress that it has it experience it somewhere in our physical being. So we'll definitely talk about all of the ways to make sure that we are moving that stress and those emotions through our body so that they're not stored up in there. But I wanted to kind of talk about that. Like, how do we recognize when we or other people we love are experiencing stress so that we can hopefully get them some help?
I think it's important to understand what your baseline is, right? For you to know, okay, this is when I'm living my best life. This is when I feel at peace, at ease. And these are the things that I can do to get myself to that point. And when you feel that you're off balance, you go back to those coping strategies or those things that help you feel balanced and help you feel back to yourself. And noticing that in other people. Sometimes people will be stressed. And instead of saying, I'm stressed or I'm depressed or I'm sad, they'll be angry, they'll be irritable, they'll be closed off and may not talk to you. And you might notice that in yourself as well. So stress and anxiety and depression and other mental health illnesses may not always present exactly the same for everybody. And also for people of color may present differently because like Dr. Maya was saying, the stigma around like talking about our mental health issues, et cetera. But it's important to realize what is your baseline. And this is something that I'm sure all of you, all of the panelists also can agree. You find that there's this baseline that you have. And when you teeter from that baseline or you're off from that, you're like, something is off. And I don't know what it is and I can't figure it out. But I know that I'm gonna need to take a run or I need to I need to paint or I need to listen to some music or I need to write in my journal or whatever it is that like brings you back to center. You identify what that is, and that's how you balance out some of that stress. And then eliminate the things that are causing you the stress. Like I had to switch jobs. Very transparent. My job was very stressful. And I was like, I'm not doing this anymore. This is not sustainable for me. And so I switched jobs. That relationship that you're in, that's toxic. cut them off. And relationship can also not just be a partner. It could also be your friend. Sometimes you have to cut off your friends as well. So identifying the things in your life that are throwing you off balance, finding the things that help you rebalance, and doing more of that and less of the things that throw you off. I don't know if that makes sense, but that's my equation.
Yes, I 100% agree with Dr. Tasha. Like knowing your baseline, if you're sleeping more, if you're sleeping less, little things like that. If you are not interested in things that you were loving before, if you're feeling, oh man, if you're feeling like guilty about doing things, these are all like screeners that I do of depression. That I do with a lot of my patients. Have you been experiencing this for more than 2 weeks? Okay, I think you might be experiencing X, Y, and Z, you know, difficulty in concentration. If you were from a straight A, I've seen this so many times, went from a straight A student and then they automatically next semester got Fs. Like that's just not like them. And I just did the screening and I'm like, I think you're depressed. So just knowing your baseline, how are you? Even if your family and friends are like, are you okay? Or if you're not acting like yourself, they should be aware of that too, and just kind of picking up on hints.
I would say from my perspective, just as a wife, mother, doctor, I think that sometimes we are asked to be superwomen. And I think that we also are raised to be superwomen. We've all watched our mothers and grandmothers, put themselves out there, to the detriment of themselves. They took care of us. They took care of our dads and our grandfathers, and it was always putting everybody else first. And I think that thankfully we are growing and changing and realizing that you can't take care of anybody unless you take care of yourself first. And I have a 13-year-old and an 11-year-old, and I am a better mother today because I put myself first a lot more nowadays. I know when I need a break. I know when it's time. I stopped cooking for a while because I said, you know what? We can buy food. Cooking was stressing me out. And so I stopped cooking for a while because that made me happier. And I was a better mother and I was a better wife. And everybody in this house was happy because mama was happy. So I just think that starting to not being afraid to put yourself first. Fortunately or unfortunately, we have been taking care of our community for generations. And we did a lot of protecting of our community in a lot of ways, like I say, to the detriment of ourselves. And so hopefully we are at a point in our evolution as a community that we start putting ourselves first a lot more.
I love all of that. And now let's get into kind of different ways that we may see stress and ways that we may not recognize. So Dr. Tasha, I know that eating disorders is something that's a part of your practice, and sometimes stress can show up in the ways that we eat and when we exercise. So I'm wondering if you could tell us how are eating disorders related to stress, and why are Black girls in particular experiencing some challenges getting help around eating disorders?
Yes, I love that you brought up this topic because I think number one, there's a lot of stigma around eating disorders. And number two, there's a lot of stigma around eating disorders in the Black community and in communities of color. It's assumed that people of color don't develop eating disorders, that's something that a thin white girl should develop and not someone else. But I will tell you, I have seen Black males develop eating disorders, males, Hispanic girls, it touches everyone. No one is exempt. And when I say eating disorder, what I mean is that you have an unhealthy relationship with food and a fear of gaining weight or a fear of food. And this is actually becoming more and more common, especially with the pandemic. What has happened is a lot of people have tried to do the best thing that, the best they can to be healthy. And they're like, you know what, I'm going to eat all vegetables and I'm going to exercise so that I could limit my chances of getting COVID. And for some people, we have to remember the brain is full of chemicals and it's full of all these connections and synapses. And for some people, their brain is just a little bit different than other people's brain. And for one person, that dieting and exercising and eating healthy can be totally something they have control of. And for other people, it can spiral out of control and it can get to the point where they start to see physical changes in their body that can be dangerous and then also interfere with their ability to live their best life. And so signs of someone having an eating disorder, and this is something that you should also look out for your friends, and for yourself is, you're restricting the things that you eat. You're like, I only eat lettuce. I don't eat anything else. I'm only going to eat these green vegetables and nothing else. And for teenagers, that's not healthy, because your body is growing and changing. You need all of these nutrients. You need fats, you need carbohydrates, you need everything to like help your body grow and your brain grow. And so by restricting your calories and restricting what you're eating, you're not getting all the nutrients your body needs to like grow and for you to live your best life. So restricting food is a sign. Not eating certain things, or decreasing the amount of calories you have per day and saying, oh, I'm only going to have 500 calories per day. All these things you guys see on Instagram and TikTok talking about these tummy teas and all that stuff, that is not healthy. Please don't do that. All of these waist trainers and other things, please don't do that. All these things that are meant to like change and shape your body into ways that are not realistic, please don't do that. Those all can contribute to eating disorder. And then also just the unfortunately, the media has shown us that if you're thin, if you're light skinned, if you're white, if your hair is straight, if your nose is this, blah, 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 then you're beautiful. And if you're not, then if you're the opposite of that, then you're not. And that is not true. And I'll tell you from my own personal experience, I'm a bigger sized person. I got curves. My skin is dark. My hair is curly. My nose is wide. It's always been something that I could never see myself in the magazines or on the TV or in places where I felt like my beauty was being represented. And that's something that I had to find and something that I had to build within myself and say, you know what, I am beautiful. And it doesn't matter if other people think that, I'm overweight, I'm still cute. And like, it is what it is. So like just finding that confidence within yourself and not listening to what the media says, because the media will tell you that you're not beautiful. The media will tell you that your skin is too dark, your hair is too curly, your hips are too wide, et cetera, et cetera. And so we have to create these spaces like this space and other spaces where we can find people that look like us and that represent us and that celebrate our beauty. Now, when it comes to getting help, I know I'm going on and on, but this is a big topic. When it comes to getting help, the main problem is doctors are not able to identify that people of color have eating disorders. So they're like, oh, it's fine. She's a little bit overweight. She's not underweight, so she doesn't have an eating disorder. But they're not digging into those other things that I mentioned about restricting calories, drinking tummy teas, taking laxatives, not loving your body, things like that. Those are all signs of eating disorder and things that doctors and other healthcare providers, and sometimes even your parents, might miss. So it's important to, if you are concerned, or if you're concerned about a friend or a family member, that you do bring it to the attention of your healthcare provider, your pediatrician, and find an adolescent medicine specialist, because that's something that we do. But it is a huge problem. And that's part of what I do with Gorgeous Doc, is try to bring awareness to this topic specifically for people of color, because it's something that's not talked about enough. And I will be quiet now.
No, it's all good. And I think the only thing I want to add is that it's also just like, sometimes it's like, oh, I'm not that bad. Like if people were listening what Dr. Tasha said and like, oh, I'm not all the way there, but like, I'm also not, like where I think I should be. Even that middle is the perfect place to get help. Like just being able to bring that up so that you don't get to that point. Because the other thing we didn't get a chance to talk about is that not only does an eating disorder affect your mind, but it also starts to affect your body too. Dr. Tasha and I see adolescents in the hospital all the time with eating disorders. And we, of course, would want that for nobody. And so I'm really, if there's ever like something about my relationship with food or exercise just doesn't feel right, like I feel really guilty, then please bring that up with somebody. All right, we want to head over to Dr. Maya and kind of really add on that conversation that you had yesterday about mental health concerns like depression, anxiety, self-harm, and suicidality. And I'm wondering, Dr. Maya, you mentioned a little bit about screening about that for patients. Can you tell us a little bit more about that looks like? And for adolescents on the call who have not had their doctor ask them the question, how can they bring that up to somebody if they're concerned about themselves?
Yes, all doctors honestly should be bringing up some type of questionnaire. A lot of times there's like a little sheet, which we call like a PHQ, which basically just screens for depression. Unfortunately, I already did the back study. It seems like 40% of primary care providers don't do it at all and don't really screen for it. So it's something that that you are going to have to advocate for if you are really experiencing these issues. So if you're like some of the signs to look out for, like we discussed, sleeping, if you're sleeping too much or too little, if you're losing interest in things, like there's a mnemonic that we use. If you're feeling guilty, if you're having low energy levels, if you're having difficulty concentrating, like the decrease or increase in appetite. So if you're seeing like there's a close correlation between eating disorders, anxiety, and depression. If you're like super tired or super wrapped up, less or more than you used to. And last but not least, if you're having suicidal thoughts. Unfortunately, a lot of, I don't know if you all discussed a little bit about adverse childhood experiences, or what we call ACEs. A lot of times those experiences, so that can be abuse, whether it's emotionally, physically, sexually, neglect. If a parent is incarcerated, if there's substance use in your family, those are a little bit more correlated with depression and anxiety. So that's why it's really, really important for you to advocate for yourself when you see a doctor. Like, I'm not feeling like myself. I'm just going through something right now, and I think I need help. So I would really, really encourage you to know your normal, like Dr. Tasha was saying, and to realize if you're noticing any changes, whether that's have a diary, or even like venting with friends. Just really know your body, and because it's life-saving if you really do. Unfortunately, I did lose one of my close friends to suicide while she was in medical school. She was my former roommate. And it's real. I never thought I would experience it. Like, all my friends are good. Oh, she's happy. You just really, really never know what the people are going through. So
I appreciate that, Dr. Maya, especially because a lot of these issues don't get recognized in Black girls. I'm wondering also, when we're bringing this up, saying I need help, what kind of stuff would you as a doctor, or should their doctors offer them, just so that they know what to anticipate as options for helping them manage all of this?
Absolutely. So there's different categories that we put. So like mild depression, moderate to severe depression. So the mild depression, like first line therapy is just like therapeutics, going to see a therapist and just kind of talking things out. If it's like in the moderate to maybe low end of severe, it is really, it's good to honestly have a safety plan with the family to know, okay, you should not have guns in the house. You should not be exposed to lots of these medications, because a lot of times it's in the spur of the moment. I'm not feeling like myself. I want to end my life. And I've seen over and over again when I finish my my psychiatry rotation as well as my emergency medicine, there's so many kids coming in with intentional overdose of Tylenol, of like whatever's in the house. So come up with a safety plan, as well as it might be a possibility that you might have to start a medication to help, an antidepressant, anti-anxiety medications. I really want to decrease the stigma. It's okay to take the medications. Like, lots of people do it. Trust, it is okay. And then if it's to the severe, where you did have that intentional overdose, or you literally had a plan, that's the thing that we as psychiatrists ask. If you're suicidal, do you have a plan? And lots of times, unfortunately, there is. And if at that time, it is not safe for you to be at home. So we like to keep patients in a safe environment, whether that be 9 times out of 10, it's in the hospital, so we can get the proper training and treatment until those symptoms have resolved. So it's really important, because like we said, it is life-changing. I wish people will not brush off mental health like it's, oh, you'll be fine, because it wasn't for my friend. It wasn't for a lot of these people, a lot of Black girls especially. So yes. Thank you so much, Dr. Fenton, Dr. Rebekah. I think this is such an important topic, and to know how to advocate for yourself.
Definitely. We have kept it real. And I also just want to acknowledge that we've talked about some really hard stuff. So I'm going to take a breath. If we could all just take a breath real quick. In and out. Thankfully, this is not where the story ends. We just want to make sure that you all are aware of these issues, because the hardest part about getting any help that you need is not even knowing that it's a problem, or people telling you it doesn't happen in our community. So let's kind of shift to self-care and coping. And I think this is where Dr. Brandi, I'd love for you to speak up about, I've sat with you, I've seen you talk to patients and how important it is for them to be able to care for themselves. And I was just thinking, as we were putting this together, I'm like, the way that we care for ourselves and our face is so related to how we care for the rest of our bodies. And so I'm wondering, why is skincare so important, and how can we model that with our other self-care practices to be able to manage all of the stress that we've talked about?
Yes. So I think going back to kind of what I said before, our skin and, our face is the way we present every day. It's the thing that we can't hide, the thing that, everybody's going to see, and where a lot of our self-esteem, starts. And so when I'm talking to my patients, and Dr. Rebekah knows this, I am, very, very real about, you being honest with yourself. So you can come in here and you can lie to me, but I know when you're lying. And, and I'm going to call you out when you're lying to me, because you're really lying to yourself, because it doesn't make me any difference. If you don't want to wash your face, that doesn't make me any difference. But then you come to me complaining about your acne and I tell you, you need to wash your face. And you say, but I didn't have time. And I say, why didn't you use your medicine? I forgot. Okay, well, when are we going to start to take some ownership of this? Your parents are not going to make you do this. And they shouldn't be making you do this. When do you have enough pride in you and and enough agency over your body to say, you know what, I'm going to take control of this. I know what I want, and I'm going to do what it takes to get there. Because none of this is free. You know what I mean? None of this happens without intention and without effort on your part. And so when you get up in the morning and you start the day by just washing your face, that is a huge thing. It wakes you up. It cleanses your skin. And I don't mean you have to use harsh soaps and things. We can get into skincare regimens if you want later. But you know what I mean? Most of the dirt on your face is washed off by water. Most people don't even need to use big, heavy soaps on their face every day. But to present your face, and whether or not you choose to wear makeup, and this lip gloss that I have on today is all that you will ever see me in. I don't have time. So, if you want to wake up 30 minutes early to put on your face, God bless you. Go for it. But for those of us who, are rolling out the bed and rolling out the door within 15 minutes, that's okay too. But getting up, washing your face, putting on, your moisturizer so that we glow, we want our melanin to glow. Okay. So moisture, we tend to have more dry skin. And for those of us who are in these colder climates, I'm in Chicago, Dr. Maya's in Indianapolis. That dryness in the air can zap all the glow out of your skin. So a good moisturizer every day will go a long way in helping keep your skin healthy. Moisturizing the skin on your body after you get out of the shower, really important. And do you have to use something special that came from Lush and Bath and Body Works and all that? No, you can get some good stuff off the shelf at Walgreens or Target, and that works just as good. And it doesn't have to smell good. Some of that is really irritating to people's skin. Okay, it doesn't have to be fancy to be effective, but you'd be surprised how taking care of your body every day lifts your spirit and your mind. And like I say, presenting a beautiful face, and that face can look beautiful and different. And just because you have acne doesn't make you not beautiful. Okay, lots of people have acne. Just because you have skin changes or skin diseases that change your skin doesn't mean that you're not beautiful. But taking care of your skin absolutely will contribute to your mental health every single day. I can guarantee that.
Yep, that's not in my head. I think even hanging out with you, I feel like, okay, if I'm telling patients I got to do this stuff, I'm doing that too. And I always tell my patients, I'm like, when you come into the office, imagine there's a big neon sign over my head that says no judgment zone. Like, I can only help you with the stuff you tell me. But if you come in here saying like, oh yeah, I'm doing everything and it's not working, then, and it's not the truth and you're not doing anything, then we can't really help you. So I appreciate how much we just try to like break that down and know that, talking to your providers or your therapist and keeping it real is really the first step to be able to like get the help that you need. Okay, now let's kind of think big picture. How do we manage stress and prevent its negative effects? I appreciate that Dr. Tasha talked about toxic stress, and that could lead to a lot of health conditions later on in life that we do not want. So what can we do now as high school students to be able to prevent and manage the stress that we're really experiencing in all those high school classes and goals for college and friendships and relationships and all of that, and even like this pandemic that's still not over? What can we be doing?
So I think just going back to what I said before, which is identifying your baseline, and then also looking at the different aspects of your life and kind of where you feel you are with each of those aspects of your life. So for instance, when it comes to fitness or physical activity, doing something that you like and you enjoy. Like some people will be like, oh, I hate running, but I'm going to run every day. It's like, then don't do it. Do something else that you like. Dancing counts, biking, skating, whatever it is, that movement, any kind of movement that makes you feel good, that's the most important. Eating, like we talked about before, restricting certain foods and being like, oh, I'm not going to eat that because that's not healthy. That is not the best way to go about it. Your body needs all different types of nutrients. It's all about balance, trying new things, finding things that you really like, and just exploring different options. And then the other thing is your relationships with everyone. Not just your partner or someone that you're in a romantic relationship with, but also your friends. Do your friends hype you up? Do they make you want to be a better person? Or do they bring you down? So identifying what your relationship is with your friends, and sometimes even your family, to be honest. Sometimes you have to say, you know what? When I talk to Uncle so-and-so, it just puts me in a bad place. So I already know what that conversation is going to be like, and I got to protect my peace at all costs. So evaluating your relationships. Finances, I think, is another big piece that we never really talk about until it's too late. So, it's important to understand certain concepts. What does it mean to have a savings account? What is a credit card? What is it this? What is it that? So learning about those things early on, so that way when you do get a job. When I got my first job, I spent all my money on sneakers and on clothes. I didn't save any of my money. And it wasn't until medical school that I was like, you know what? I should probably have a budget. So, understanding your finances, understanding, the different terms and things that people use around money. Sometimes we don't get taught that by our families and by our parents and by other, adults in our lives. And unfortunately, sometimes we have to learn it ourselves. So looking at that aspect of your life, the spiritual part of who you are. Some people are religious, some people are not. Do you go to church? Do you not go to church? If you don't go to church, do you read the Bible at home like once a week? Like whatever it is that like brings you at your baseline, identifying that. And so just like looking at the different pieces of your life and seeing kind of, making sure that you are not at any given point spending more energy in one area and not addressing the other areas, and making sure that you have balance. Another thing too is your environment. Like, is your space clean? Does that stress you out or does it not stress you out? For me, if my apartment is messy for 2 days, I'm not good. 1 or 2 days I could do it, but 2 days is the max. And after that, I'm like, okay, I got to straighten up because I'm feeling anxious. Everything is everywhere. I don't feel organized. So like your physical space is also important too. So just addressing, looking at all those different things and making sure that you're at your baseline, and not spending too much time investing in your relationship and not enough spending, time investing in your health or your physical fitness, or you're making sure that you're eating healthy, or your financial, your career goals and other things. So just finding that balance.
Does anybody have anything else they want to add to that? Okay, I realize we have not yet talked about social media, and I just want to acknowledge that as somebody who uses it and has patients who use it, that it is a mixed bag. Like, I want to acknowledge that there absolutely are good things. Like, definitely for me, funny TikTok videos in the pandemic were like the thing that made sure that I laughed every day, no matter how our world was. But that also social media can, for many people, be a hole where we stick in it and we're constantly, we call it doom scrolling, just reading the news and the terrible things that are happening in the world, or comparing ourselves and our lives to other people, recognizing that they're showing that shiny 10% of when we go on vacation and take a whole bunch of pics, rather than us living the reality of our 90% of like, hey, work is hard, life is hard, friendships are hard, and that's not the full picture. And yet we're comparing our worst at somebody else's best and feeling bad about ourselves. And so also being really aware of like the boundaries that we're setting around that, and making sure that we're not spending too much time there. And then we're also getting reminders of like, let's live our real lives in person as much as possible, or phone calls or something that allows us to really talk and say like, hey, how are you really? How are things going? Rather than necessarily kind of putting out that perfect image. So just want to mention that one too. All right, I'd love for us to get a little personal and talk about our own coping skills. I like to talk to my patient about coping skills almost like a toolbox. Same way that like a contractor shows up to a job, it's got big tools, including their hammer, their wrench, and all the other kind of things. For what we need in each individual person, we have a tool that we can go to be able to help us through that situation. So if I think about my coping skills, I definitely start all my mornings with my devotional reading the Bible. That just helps me like set my mood for the rest of the day. I love dance. I accepted, like Dr. Tasha was talking about, I hate running, will never run, will not, like, just not even going to try anymore. But dance makes me like have fun. And then at the end, I'm like, oh, and I worked out too. My body likes that. But rather than working out for the purpose of like, oh, I just got to get through this, that's just not who I am. And then I love reading. And so that's been something that is just kind of allows me to focus on one thing, where the rest of the day, often my brain is spinning. So I'm curious for each of you, maybe you could list like 2 or 3 coping skills or things that you use as distraction or self-care over the course of the day, just to give some examples for the girls listening.
I would say for me, humor is a huge thing. So I laugh a lot. Dr. Rebekah's been in clinic with me. Most of the time, if you're standing outside my exam rooms with me and my patients, all you hear in there is cracking up. We are in there laughing and joking and having fun. And I appreciate that, my patients can do that with me, because I need that from them. Even when I'm with my nurses, I have great relationships with all of the support staff in my office, because we are always laughing. And, I'm always like, we are not that important. We cannot take ourselves this seriously. You know what I mean? So laughter is a huge coping mechanism for me. I am a part of social media. I'm not probably engaged in social media. So actually I use that as a coping, like that's my downtime. That is my do nothing time. So I will sit there and scroll and click pictures of babies and, laugh at jokes and, read a couple of, really deep articles that make me feel like an armchair activist. Then I move on. And then lastly, I think for me, being organized is actually a coping mechanism for me. So just like Dr. Natasha was saying, when my world is out of order, I am stressed. And so sometimes I just come home and get on my computer and I delete emails. And it's so good. It feels so good because I'm checking things off my list. I love to check a list. And so for me, that is a coping mechanism. When I'm feeling overwhelmed, when I have too much going on, straightening up my room, emptying out my email, and organizing my to-do list make me feel better. They make me feel in control. And I feel like I can tackle, one thing at a time. And that is very important to me because feeling overwhelmed I will decompensate, you know what I mean, when I'm overwhelmed. And so being organized is actually a really big coping mechanism for me.
For me, I have a puppy. He's like been running around. Like just taking care of him is just such good self-care for me. I do have a therapist, so that's another. I'm pro therapy. I know. Yeah, it's very good for me. And as you can tell, I have a lot of plants. I love like going house plant shopping. So that's just a form of coping for me. And I also collect perfume. So I feel like I have a lot of different little niches that just make me happy. And brunching, of course, makes me happy.
So for me, like Dr. Bryan was saying, therapy has been super helpful for me. I think it wasn't until the pandemic that I realized I needed help. I had been functioning high functioning. I had high functioning anxiety, right? And a lot of people are like, "Well, I'm fine. I'm still getting everything done, so I don't need help. Like I'm okay. I'm okay. I'm okay." And I had put a lot of value on being productive. I put a lot of value on like getting things done, and it took for the pandemic for me to realize all these other coping strategies that I had were not going to address like this underlying anxiety that I had around feeling like I always needed to be busy. It was really hard for me to just sit down and relax. And if I did, I would be like, oh, I didn't do anything today. Like I'm useless. All I did was watch TV. And sometimes that's okay. And therapy has truly taught me that. So I recommend everyone get a therapist. If my patient comes to me with a rash, I'm like, do you have a therapist? Sore throat, I'm like, do you have a therapist? Doesn't matter what they come for. You're gonna get offered therapy if you come see me. Because these are just hard times that we're in. But anyway, yeah. So therapy. The other thing that really helps me to de-stress is physical movement. So like Dr. Rebekah was saying, dancing. I love music. So I'll just literally just turn on some Afrobeat. I'll just blast it and I'll just dance in my living room. And honestly, that relieves so much stress. And then the third thing for me is drawing. I've always loved to, and writing. Like I said, I wanted to be a journalist when I was younger, and I still write. I had a journal all the way from second grade all the way through college. In med school, I stopped writing because I was like, I don't have time for that. I have to study. And then recently I like picked up writing again. And then I started drawing again too. And then I actually use my drawing to like create sexual health images for people of color. And so now I've married my coping strategies and things that make me happy with something that I feel like is making a difference in the community. So it's been a really great experience. So I would say, everybody's different. You just identify the thing that like, once again, brings you back to your baseline and the thing that makes you happy unconditionally, and just make sure you do more of that.
Lovely. Well, that's where I want to end the questions I have prepared just so that we can open it up to our audience. We've got about 81 high school students who are listening to us right now, as well as their girl exchange leaders. And I've already seen people, I don't know if you see the comments popping up at the bottom. We're loving our conversation so far, and it's really encouraging for us to hear. I think our first question has already come up, wondering about what is the role of sleep and does that help with our stress levels? So if anybody can hop in and answer that question.
Absolutely. There's no question. There's science behind it. There's data behind it. There's real life experiences behind it. If you are not getting adequate sleep, you are not going to be okay. Whether that be physically, mentally, emotionally. So getting adequate sleep, and that's different for everybody. Everybody doesn't need 8 hours. You know what I mean? Some people function really well on 7 or 6. I mean, science will tell you that 8 is ideal. But if you need 10, then you need 10. And you don't do great on 8. My sister needs 12. I do pretty good on 6. So it's different for everybody, but it's absolutely crucial. And when you are not sleeping well, you are not going to be well. You won't be able to focus as well. You won't be able to execute tasks as well. You aren't driving well. Your reflexes are off when you're not getting adequate sleep. All that contributes to stress.
And
And
going off of Dr. Braun, go ahead. Sorry, go ahead.
no, I was just
Dr.
going to say teenagers need more sleep than adults. So a lot of time teenagers will be like, oh, it's okay. I got 5 hours sleep. No, that's not enough. As a teenager, you need at minimum 8 to 10 hours of sleep per night. At nighttime, your brain, remember we talked about how your brain has all these synapses and chemicals and stuff. Your brain is still developing until you're 25 and sometimes even beyond that. So you need as much sleep as possible. So sleep cannot be underrated. Please, please, please get your sleep. And when you're an adult, you're going to wish that you took all that sleep that you could have when you were a teenager.
Yes, and going off of them, I really want to talk a little bit about sleep hygiene. Like, it's really important. I know we're in the social media era, but you can honestly sit there. If you have your phone with you, you could probably scroll on TikTok or Instagram for hours and hours and hours. So I would really advise maybe like 30 minutes to an hour. I know it might be hard before you go to sleep. Try to put your phone down and focus on having good sleep.
Perfect. I'm going to keep these questions going. The next one is, what's the importance of finding a balance for yourself or finding a balance for life in general?
Finding balance is super important. And it's not I want to make it clear. Finding balance is not something that you're going to achieve and then you're done. You're going to constantly be trying to find balance. All of us on this panel are always trying to find balance day by day, hour by hour. So it is not something that you're going to just achieve and be like, okay, I did it. It is super important to continue to try and strive for balance. And there's going to be times where you're off balance, but it's important that you recognize that you're off balance and then figure out what is the thing that is off balance and then correct it. So that way you can get back to your baseline. I know I keep saying that, but it's super important. And it's something that, we as Black women have to identify because people will try us. Society will try us, coworkers will try us, partners will try us, people will try us. So we have to make sure how do I get back to my zen? How do I get back to this point of being my best self and make sure that we, address the things that are contributing to us not being our best self.
I'm going to keep it. Oh, sorry. Go ahead. Go for it.
No, I just want to stress the importance of protecting your peace. Like what we all said, knowing you're normal. And if people don't bring you peace, and if you can I can feel energy. I feel like a lot of us, you can get that gut feeling about different energies. And some people are energy vampires. So you really want to just be careful of the company that you surround yourself with.
All right, I'm going to move us along. So the next question is, Black girls, are there any health conditions that are common with us that we should be watching out for?
I think it's important to recognize that as Black girls, we're humans. So there's a lot of things that affect everyone that also affect us. The problem is people don't listen to us. The problem is people think that we don't have these disorders and we don't have these problems. So it's important for us to understand our health, understand our body, know the right words to use and say, I have a rash on my vulva and not I have something going on down there. So that way we can advocate for ourselves with our partners and with our doctors and our healthcare providers. So I wouldn't say that there's anything specific that Black girls are more predisposed to getting because of who we are genetically. It's all about society and the structures that are in place that prevent us from getting the care that we deserve or being diagnosed with the things that we also have that other people have. I don't know if that makes sense or if you guys agree.
I would say from my perspective, from a dermatologic perspective, there are absolutely things that affect people with skin of color more often than others, but a lot of them are tied to other health problems that, are affected by social determinants of health. That being said, there are some things I want to give a shout out to because I feel like they are grossly under-recognized. One of those that I specialize in is something called Hydranitis Suppretiva. Okay, it is a huge problem in the world in general that is only recently being recognized more. And I see it way more in my young women of color, especially my Black girls. This is when you get what most people would call boils. Okay, so kind of abscesses or pussy bumps that are in your groin, under your arms, under your breasts, sometimes in between your buttocks. This goes on for years for most women, young women and young men, with them going repeatedly to the ER, repeatedly getting surgery for these things, which is not the ideal treatment for this condition, but it is so under-recognized. And I see so many young men and women who come to me finally and get a good diagnosis and appropriate treatment. So I cannot leave this without saying, if you are a person, a girl on this call who gets frequent quote unquote boils or spider bites or whatever in those areas of your body, you need to go to your doctor and say, I think I might have this condition, because so many pediatricians, so many general practitioners just are not aware and not recognizing it. So I need to give a shout out for Hydranitis Suppretiva.
No, I think this is a chance. This is why we do this and make those plugs. So I appreciate you doing that. The next thing I want to hop into is somebody's asking, are there any specific brands of feminine products that you would all recommend for somebody who has highly sensitive skin? So I don't know if Dr. Tasha, you want to take this one.
What I will say is less is more. Like Dr. Brandi said, some people wash their face with just water. Some people wash their vulva with just water. If you are the kind of person who all these products from like Vagisil and all these other with flowers and mangoes and whatnot, you don't need any of that. Plain water is fine. You have to find the product that works best for you. And sometimes it's best to just use nothing. So you can try that. The other thing is Dove or any of those like sensitive skin type of soaps. Those are best. No, don't put anything in your vagina. So no like douching, no, I see a lot of people, there's some products that contain like boric acid and some products that even contain like antibiotics and all these other things. If you're having like a smell down there or any kind of like, change in your vaginal discharge, anything like that, you should go and see your doctor so that they could properly diagnose you and treat you and make sure that there's not anything abnormal going on. But for the most part, I would say there's a good article. I can put it in the chat and then we can link it in the comments. But there's a good article on this website called Center for Young Women's Health. And it talks all about vulvar and vaginal care and all the different things that people can use. A lot of times too, one of the issues is people do a lot of shaving and waxing and plucking and razoring to their genital area. That can also cause a lot of irritation. And so I normally recommend not doing all of that. Trimming with scissors is just fine. And identifying a product or method that works for you that is not going to cause lots of irritation. But if you are ever concerned and you're like, something's not right down here, and that's why it's important, once again, to know your baseline, not only mentally, but also physically. Take a mirror, look down there, see what it looks like. And if something goes wrong, then you're like, oh, that wasn't there before. And you go to your doctor and you can, adolescent medicine doctors are perfectly equipped to take care of this. GYN doctors, as well as most general pediatricians can also identify if there's something abnormal going on in your genital area. But for the most part, less is more. So all of these like yoni beads, steams, blah, 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 don't do any of that. Don't do any of it. Dr. Brandi, can you speak on it?
Oh my God. You are like speaking to my soul right now. Less is more. Y'all, our skin is meant to heal itself. Our vaginas are meant to clean itself. I used to have an attending who's called the vagina a self-cleaning oven. Like, you don't have to stick anything up there. You don't have to wash it or douche it or steam it or anything. It does its thing if you leave it be. Also, shaving. This generation is obsessed with shaving. Humans are supposed to have hair, y'all. Like, we are supposed to have hair. You are not supposed to eliminate all the hair from your body. That is not healthy. It is not good. I can understand if you don't want, big bushes under your arms when you're wearing a tank top or whatever. But at the same time, you do not need to rub a knife across your skin multiple times, a week, every week. That is not good for your skin. And then you come to see me, you're like, I have razor bumps. And I say, stop shaving. And you say, no, I have to shave. No, you don't. No, you don't. You don't have to shave. So just less is more, and doing all of these different things does not do more for your skin. In most cases, it just makes things worse or creates secondary problems that then you need medical treatment for. So as much as possible, please. And granted, let me make another plug. All natural is no such thing. Okay, I don't know where that term came from. It's not regulated by the government or the FDA or anybody else. Poison ivy is 100% natural, and you're not rubbing that all over your skin. Okay, so don't let labels and like buzzwords and clickbait, trick you into believing that, just because something reads all natural because it comes from the earth, it's all good for you. You can be allergic to things like that too. You can be sensitive and have irritant reactions, things, that all kinds of different things. So just be kind to your body. Less is more. Be happy with the skin you're in. If you need me to fix something, let's do that. But come to me first. Let's talk about it. Do not go to TikTok. God bless TikTok. You know what I mean? Ha ha ha. Great videos. Not great medical advice. Not great medical advice.
Yes to everything. And the only thing I was going to add, as far as sometimes you'll see on pads and tampons that they'll advertise scented. You don't need it. We just talked about there's nobody who can smell that you're on your period, just like those scents can actually cause greater irritation. So that's as far as my only product recommendation is that. And also there is a whole aisle, we've all seen it, Vagisil, everything that is literally just marketing you and making you feel like there's something wrong with your body that you need to treat. And all of them are a waste. We talked about this last year, but for those who weren't there, you're just washing with water and letting it kind of rinse down there. And at most, maybe where you've got hair, you're using a little soap, the same soap that you're using on your body, only a little of it. I appreciate that Dr. Tasha is going to include that link just for care. But yeah, there's basically all these products that you don't even have to buy. And that's money that we're saving, being able to use for other stuff. All right. I know that you wanted to take this one, Dr. Brandi, but where can we find Black doctors or Black dermatologists in particular?
I actually put it in our private chat. So I was thinking somebody could copy and paste it into the regular comments, because I can't comment on the regular comments. But there's a organization called the Skin of Color Society, and they have a Find a Doctor link on there. And so you can look up doctors who have registered themselves in the Skin of Color Society database. Now, it is the Skin of Color Society, so there will be more than just Black doctors on there. But I always tell people when they ask me, can you refer me to a good Black doctor? I'm like, I refer you to a doctor who knows how to take care of skin. You know what I mean? And any doctor who is worth their weight knows how to take care of all types of skin. But you might find, yes, that there are those who have you have a cultural affinity with, who you have maybe just an emotional connection to or whatever, because they look like you, and that is totally okay. But finding a good dermatologist, sometimes they don't look exactly like you. But there are plenty of people out there who are interested in and specialize in taking care of skin of color.
Perfect. And I know that there's a link, Dr. Meyer, that you want to shout out that's also going to end up in the YouTube chat, but tell us what you're about to share with everybody.
Yes, I have a Therapy for Black Girls link. So all you have to do is just literally put in your zip code, your address, and it has a lot of the licensed therapists in your area. So putting in a plug for that.
All right. These links are coming. Dr. Tasha, tell us what you are sharing with people too, as far as looking for Black providers.
Yeah, so I just included in the chat a link for an organization called Health in Her Hue, and it was founded, I think, during the pandemic in 2020. But it's a directory of doctors of color, of all different types of doctors. So pediatricians, OBGYN, psychiatry, whatever type of doctor that you need. And then the other thing is somehow all Black doctors know each other. So if you know a Black doctor in a particular field, you can still ask them like, hey, do you know anyone else that's in this field? And we can always connect you. So if there's anyone out there that's looking for a specific type of doctor in their particular area, you can also reach out to us and let us know, and we might know somebody and we could connect you.
Perfect. I appreciate all the links getting dropped. Let's go to our next question, which is, how do we feel comfortable talking to male doctors about our bodies? And I'll also just add in general, how do we make sure that we have a good relationship with somebody who, we're loving all the Black girl magic, but the reality is, as we said, we're only 3%. So a lot of us are going to see doctors who don't look like us, either racially or don't share our gender. How do we make sure that that is a good relationship for us?
I think you have to just remember that we're all medically trained. We all, but it's okay to look for what you want to look for as well. If you want a female provider, it's okay for you to say that. I usually just give them a chance. And if I don't feel comfortable, if I don't have a connection, I just move on to the next one. But we all are all medical doctors, and it's okay to say yes or no, since it is your body, and know your boundaries. If you're feeling triggered, if something, and you don't want to have a male provider, it's okay for you to not want a male provider.
I think also not all doctors are created equal, and we have to understand that. And not all therapists are created equal either. And you have to find someone who you trust and someone who listens to you and will address your concerns. I specifically found a Black female doctor, and I was like, oh yes, she went to the same place I went to for med school. She's young and hip. This is going to be lit. And I she walked into the room. She didn't make eye contact with me. She turned around. She was on the computer. What brings you today? You know, she's typing on the computer. And I'm like, that's strange. You know, I was expecting her to be great. And then I was like, you know, I have this medical condition that needs to be followed up with this specialist. And she was like, oh, I didn't hear anything on your exam today. And I was like, I definitely have I have a heart murmur. And I was like, I definitely have a heart murmur. I listened to it myself. I'm a medical student. I know that I have it. Like, I need you to refer me. And she was like, oh, well, I don't know. And she gave me such a hard time. And I was like, what is going on here? And like, honestly, it's not always just about color. It also is about the relationship that you have with the doctor. And she was very dismissive of my concerns. And I was not feeling that. And needless to say, I did not go back to her. So it's also important to find a provider who you align with and who meets your needs. And it's okay for you to advocate for that. And once again, I'll go back to it. I know I sound like a broken record, but knowledge is key. And you understanding your body, what's normal for you, what's not normal for you, how to explain what symptoms you're having, where you're having it, how long you've been having it, how it differs from your baseline is super important for you to be able to communicate with your doctors. And that way, you know, regardless of who they are, you're able to tell them this is what is going on and this is what my concern is. The other day on Instagram, I saw someone put up a really good post about asking the doctor, what is your differential diagnosis? And I think that is a great tip and tool. Asking the doctor, what do you think? What other things do you think could be going on? I know you're telling me that you think this is just stress, but what are the other things that could be causing my chest pain? And why do you think it's not that? And feeling empowered to say those kind of things to your doctor is super important. Don't trust always don't trust Dr. Google all the time, because Google will tell you that you have cancer and that you're dying. But it is important for you to ask your doctor, what are the other things that it could be? And are you sure that it's not that? And how have you ruled that out? And what are the other things the other tests that we could possibly do, or the other other referrals that you could possibly make to make sure that it's not that? So it's important for you to do your own research about what you think might be going on, what is different for you, and then being able to communicate that with your doctor. And then the one other thing I would say is I have a patient who has a very complex medical history. She has a lot of medical problems, and she's going to have her wisdom teeth removed in a couple of days. And she was on the phone with the anesthesiologist, who's the person who was going to put her under anesthesia and have her, go to sleep during the procedure. And I heard her say, "Who am I speaking with?" They were like, "Oh, I'm the resident, blah, blah, blah." And she was like, "Oh, is it possible that I could meet the attending who is going to be on the case and who's going to be doing the procedure, so that I can make sure that they're aware of all my medical problems, and that way that I know that they know what they're doing." And I thought that was just so powerful. If you're in a situation where you feel like this is not working, you can always ask, is there another provider that I can speak to? Or who is the person who's actually going to be involved in this case? Can I speak to that person? And best believe your people that look different than you do that all the time. So don't be afraid to advocate for your needs and advocate to speak to, the doctor that's in charge, or if you feel like things are not going in the direction you want, switching to another provider who listens to you.
And I just want to add connect that to the last question that we have up here, which is like body types. Similarly, any doctor who makes you feel that your body type is not what it's supposed to be, like you need to lose weight in ways that are really unhealthy, is not a good fit for you. Somebody should be able to say, like, actually, let's look at your labs, and are you at risk for diabetes? Do you have high cholesterol? Those are things that we need to change as far as we talked about already, exercise, nutrition. Like, that's really what's considered health, rather than these other ideas of just making it based on your weight alone. So hopefully the Black doctors you meet are also understanding and getting that, but more importantly, it's got to be somebody who knows and understands you to be able to make sure that they're a good fit. I don't know if anybody else has things that they want to add as far as like doctors who are thinking about holistic health rather than being so focused on weight.
You can be skinny and very unhealthy. So like we said, you want to be holistic, and, people sometimes are overweight and they're very healthy. That's just their body shape. And that's just like their family, lineage, just how they're shaped. So I would want to say, like what Dr. Rebekah said, focus on holistic health. Are you eating healthy? Are you drinking water? Are you making sure you eat your veggies, things like that? And just look at things holistically instead of just whether they're skinny or whether they're overweight.
And like I said, I'm a curvy bodied person. So that's the last thing I'm gonna tell somebody is that they need to be skinny. You have to embrace who you are and where you're at. And as long as you're doing some physical movement and you're eating a well-balanced meal and you feel good about yourself, that is more important to me than the number. You know, everybody's body is different. BMI is something that was calculated, not taking into account all the different body types and all the different races and other things in the world. And so I use it, you know, as a guide, but it is not the end all be all. So it's important to recognize, once again, what's your baseline. Sometimes people come from a family that is quote unquote big bones. Like that is, you know, everybody's body type is different. So it's important, not just the number, but also the trajectory of how much you've been gaining weight. Like Dr. Rebekah said, looking at other things that we would worry about associated with weight, like diabetes and cholesterol. And if all those things are fine and you're eating healthy and you're exercising and you feel good and you look good, your skin is good, you're drinking water, that's all that I care about. That's all that I care about.
I'll add, not to be a contrarian or a little bit of a Debbie Downer, but there are certain skin conditions that are related to being overweight or being obese. And so sometimes people come to see me and I'm talking about, you know, what the diagnosis is. And I'm, you know, gently, and sometimes it may not even happen on the first visit. Sometimes I need to establish a rapport with you before I'm going to talk about, you know, something as sensitive as weight with the patient. But there are certain times when, you know, it's the elephant in the room, in the sense that, you know, if you come to me for acanthosis and you say, the acanthosis is when you get these dark, kind of thickened areas on your skin, sometimes on the back of your neck, sometimes under your arms. And that can be a sign of prediabetes. And in fact, in most cases, it is a sign of prediabetes. And so you also want to be open to conversations about, you know, what the realities are. Like they say, you know, we're not just looking at the numbers. We're not just looking at a number on a chart or whatever. But when I see that, I'm doing you a disservice by not saying, okay, this is, you know, likely related to these things. We need to check these labs. And unfortunately, I can't make that go away without addressing all these other things that are going on in your body. When we were talking about HS before, we see a lot more hidradenitis HS in people who are overweight. And there's good data to suggest that a lot of that can be, will be gone with weight loss alone, that people's diseases have been cured. And so having those conversations, you know, with your doctor, you should be able to have that with a doctor that you trust, and a doctor that, again, is not seeing you only for that reason, but sees, you know, the entirety of you. And I want these girls to also be open to, you know, listening and hearing when they are not at their best, when, you know, there are things that they can be doing, better ways to be, you know, eating, better ways to be taking care of their bodies that can lead to better health as well.
Yeah, I appreciate you kind of tying that in together. I guess I find myself, I told my patients that, like, I don't actually care about that number that it's associated with, but if you know, at, let's say, I'll talk for myself, I'll be honest. Me at 220 is me eating more frequently than I should be as far as like fun food, and it's me not exercising at all. Somebody else's 220 could be like running marathons. And so that number means nothing. And also that's not even factoring heights and stuff. Me at like 190 to 200 is like me exercising regularly. So realistically, in the pandemic, I have not been that. And I weigh myself because I also know that, like, you know, and you never feel good when you weigh yourself. If you know, if you're happy with it, you think you got to do more. If you're sad with it, then you feel bad. So I just know, you know, okay, how my clothes are fitting and like, what did my life look like? What am I eating? How am I exercising? And so it's really more about, like, as we talk about, I think really that know your normal ties into everything we've talked about, like know your normal kind of body shape and height and weight and all of that. Know your normal mental health status, you know, your normal body function. And so I appreciate that we keep going back to that. And I want to make sure that that's something that people walk away with. We have a few more minutes. So if there's any other questions that people have before we wrap up our session, please feel free to put those in the chat. While we're waiting for a couple of questions, I don't know if there's anything else that people want to make sure that we put in a plug for after you've had this whole conversation, make sure that we're leaving our high school girls with the final pearls that they need to be able to wrap up the session.
I just want to say thanks for having us. I think, at least for me, I'll speak for me, but these are the type of things that recharge me and remind me why I do the work that I do. And you know, we were all where you were at some point, and I wish that I had people tell me what I'm telling you now, which is why I'm telling it to you now. It took a while for me to like kind of find my lane and understand like I am who I am and embrace and love who I am for all the different parts of myself, when I'm balanced, when I'm not balanced, when I'm good, when I'm bad. And I just want that for all of you. And it's a constant journey of trying to be a better person and figure out who you want to be, not just like what you want to be. I think there's a lot of emphasis on like, oh, I want to be a doctor, or I want to be a teacher, I want to be a this, I want to be a that. But I think it's more important to understand who you want to be, what kind of change you want to impact on the world, what kind of person do you want to be, and that will be your guiding light, and make sure that whatever you're doing is always reaching back into that goal of like who you want to be, and what mark you want to leave on the world.
I love that, Dr. Natasha. My goal was to always try to eliminate health disparities and making sure that people can just get the best health care. And I knew for that, I want to become a doctor. So just always see what your end goal in life would want to be, and then just see how life will follow you. And yes, thank you so much for having us. I really wish when I was in high school, somebody had these conversations with me. So.
And I just want to say, do you. Don't let anybody else tell you who you are, who you should be. And as long as you are being true to you, and, doing what you know is right for you, I think that you will not go wrong. We are all here because we were determined. We saw what we wanted to be and what we wanted to do, and we just marched toward that goal. Tripped up side chats and side roads, be damned. We ended up where we wanted to be no matter what, because we believed in ourselves, and we believe in y'all, and that's why we're here.
Love all of that. I just want to kind of summarize some of the points we talked about, just so that those are the things that stick with you. So again, we talked about knowing your normal, your mental health status, your body, and caring for yourselves, and recognizing whenever you're a little off your normal, that may be a reason that you want to go talk to your doctor, your therapist, to bring that up and figure out, how do we get back to where I was before? I love that Dr. Brandi, when she's talking about care products, says it doesn't have to be fancy to be effective. I get it. I walk by that Lush store too, and I'm like, oh man, it smells so good, but also like my budget just cannot afford that. And so getting stuff that ideally, especially if you have sensitive skin, doesn't have odors and irritants with it, and everything that's natural. It's not necessarily good for your body, but more important to have things that you really love doing that also can fit within your budget. We talked a lot about self-care, the importance of getting enough rest, skincare being something that allows us to be able to present our best selves to everybody, again, being that the first thing we see, and also building our toolbox. What are the things that you get to go back to and that you do consistently to make sure that you're recharging amidst everything that we've been talking about? We talked about signs of stress and how that could be things that we experience in our bodies, or depression or anxiety, and the importance of really being able to bring that up with somebody, and that therapy and talking with your doctor, and sometimes including medications, can be the way that we address all of those conditions. And that, again, we as Black girls are beautiful, regardless of what society, social media, friends, others, sometimes even family members commenting on how we look a little chubbier this year say, that like, it's so important to be able to love and care for who we are as we are. And so we are so grateful to be able to be here and share this content with you. I hope this brings up other questions. I just want you to know, if that you didn't get your question answered now, that in your small group session, which will be later this afternoon, I handpicked some of my favorite doctors to be able to sit in those rooms. And so if there's something like, you're like, oh, I forgot to ask this, but I really would love a doctor's opinion, we're there. And just know that we are a part of the global community of Black girls who love you, who want to see more of us in this field, and most importantly, want to see you thrive. So we're so, so grateful that we got to be here. I love that you all have not even met and just vibed this whole time. So thank you, Dr. Brandi and Dr. Tasha, Dr. Maya, for being here and sharing your expertise and your love for Black girls.
Wow. Thank you so much, Dr. Rebekah, Dr. Brandi, Dr. Maya, and Dr. Natasha, for all of the information and wisdom you shared with us. And I love that you all mentioned different ways girls like me can combat stress, one being physical movement.